Welcome to Discovering True Health, where our goal is to provide you with cutting-edge health information through research, interviews with experts, and personal journeys to true health. Our message is a message of hope and healing, and our mission is to bring you on a journey to discovering true health, to not only find wellness, but to thrive. Hello, everyone, and welcome to Discovering True Health, your weekly deep dive into health and wellness. Thank you so much for being here. Don't forget to hit the subscribe button to stay up to date on all our upcoming shows. You can also check out additional information on our website, Instagram, or Facebook. All those links are below. So today we're going to be learning about mental health and substance abuse in adolescents, which I myself have had someone close to me pass away from an overdose much too young. So it's a topic very dear to my heart. The drugabusestatistics.org reports that youth drug abuse is a high-profile public health concern, with at least 1 in 8 teenagers abusing an illicit substance in the last year. So my guest today is Richard Capriola, who has been a mental health crisis and addictions counselor for over 2 decades at the Menninger Clinic in Houston, Texas. It's one of the top 10 psychiatric hospitals in the US that specializes in the assessment, stabilization, and treatment of adults and adolescents with substance abuse and psychiatric disorders. He's also author of The Addicted Child, A Parent's Guide to Adolescent Substance Abuse, which is an absolute must-have resource and roadmap for any parent navigating through substance abuse with an adolescent. And what I really love about your book, Richard, is that it's full of facts, practical steps, and critical information that's easy to understand, but it's also really heartfelt and addresses the emotional struggle that both parents and teens are going through. So thank you so much for joining me today.
Thank you. Thank you so much for inviting me to the program and for taking the time to read this resource, which I hope will be very valuable for parents and families to give them the knowledge and the background about this important issue. So thank you for taking the time to talk to me, and thank you for taking the time to read the book.
Absolutely. All right, so let's start with the basics. What are the warning signs that parents should know about?
Well, so many times I would sit across from a family and I would go through their child's history of using a substance. What drugs or substances were they using? How often were they using? When did they begin? And I would give them the diagnosis of a substance use disorder. And when I finished, they would look across at me and they would say, I had no idea this was going on. Or if they did suspect their child was using a substance, they would say, I sort of thought something was going on, but I didn't know it was this bad. And these are good parents. These are very good parents doing the best job that they can. They miss the warning signs because nobody told them what to look for. Nobody said these are the things you should look out for. So after I left Menninger Clinic, I wanted to put this book together to be a resource for parents. And in the book, there are warning signs for alcohol and marijuana. There's warning signs for a child that might be developing an eating disorder or self-harming themselves, because sometimes those can accompany a child who's using a drug or alcohol. But as a general rule, what I recommend is that parents pay attention to the changes that you see in your child. Don't assume the changes are just normal adolescent acting out. They may very well be that, but they might be an indicator that there's something else underneath the surface. Some examples would be a child whose grades are beginning to slip and decline. A child who used to be very vocal and outgoing now becomes very isolating and quiet. A child who used to participate in sports no longer wants to participate or enjoy sports. A child who used to introduce you to their friends, you knew who their friends were, you might have known who their family members were, now becomes very secretive of who their friends are. So these are some examples of changes that you might observe in your child. If they don't last very long, they're very temporary, it's probably not something to be concerned about. But if they linger on and you start to see more and more of these changes, then I think it's time to get some assessments done to get the information as to what's really going on with your child.
Got it. Yeah, that's really great. Now, in your book, you state that if a parent suspects their child is using drugs or alcohol, they should obtain a comprehensive assessment from a team of licensed professionals. Can you give us an overview on what a comprehensive assessment is, why it's a vital step, and is there anything else you recommend parents do if they suspect their child is using a substance?
You want a comprehensive assessment because you want a complete picture. Certainly, you want to have a history and information about your child's substance use. And that's what an addictions assessment from a licensed addictions counselor like myself would give you. It's going to give you the information about your child's use of a substance. But there may be more going on with your child than just substance use. There might be some underlying issues that you're not aware of. Things like anxiety, depression, some type of trauma or bullying that might happen at school that as a parent you knew nothing about. So it's important that we look at more than just the substance use, because in some cases, not every case, but in some cases, there's an underlying issue that that individual is using a substance to medicate. It might be anxiety or depression. So we need to know about that, because if that exists, that needs treatment too. So in addition to an addictions assessment, you'll want to get a psychological or a neuropsychological assessment. And that's going to give you information on whether or not there's any underlying emotional issues your child might be struggling with and using a drug like, say, marijuana to medicate. You'll also want a good physical examination to make sure that there's nothing medically contributing to the behaviors that you're seeing. So those are some examples of a more comprehensive picture. Too often we tend to focus just on the alcohol and drugs, and we take the position, well, if we can just fix this, everything will be okay. Well, it's not that simple, because if a child or an adult is struggling with with an underlying emotional issue that they're using a substance to medicate, if we don't address that issue as well, then the chances of them moving away from the substance is very small.
Yes, that makes a lot of sense. Now, if a child does need treatment, what options are available? And from your experience, what are the most effective?
Well, there is no one treatment that applies to every child, because it gets back to doing the assessments, figuring out what the issues are, and then developing a treatment plan that's very specific for your child. Some children will do very well in an outpatient program where they see somebody maybe once or twice a week. Other children might need what we refer to as an intensive outpatient program where they see somebody several times a week. And then for some children where the substance abuse is severe and the underlying psychological issues are there, they may be looking at what we refer to as residential treatment, which would involve treatment in another facility, a residential facility that might last weeks to months. But generally, those you see those situations of residential treatment when the substance abuse is severe and the underlying emotional issues are pretty severe as well. But a lot of kids will do very well in an outpatient type of program.
Got it. So yeah, like everything in health and wellness, nothing's a one size fits all. We
Right.
need to not only address the, drug abuse, but also the underlying issues that go along with it.
Yeah, that's very important. You need to, first of all, discover if there are those underlying issues, and then they need to be treated as well. And an example would be a lot of the children that I worked with who were smoking marijuana. When I asked them to help me understand why they were smoking marijuana, the number one answer that came back was, it helps me with my anxiety. So that's an example of how, in some cases, in quite a few cases, there is this underlying issue that the child or the adult is trying to medicate.
Absolutely. Now, in your book, you talk about development of a child's brain, which was really fascinating. How, and you talked about how it's not developed until they're 25, which is an important difference between adult and adolescent substance disorders. Can you talk a bit about the neuroscience of substance abuse in adolescence in terms of how alcohol and drugs have the power to change or damage a child's brain?
Yeah, I think it's important that parents understand that the adolescent brain is in the process of maturing and developing. It's forming those circuits within the brain that the child will need later in life as an adult. So our brains, as you noted, don't become fully developed until around age 25. So an adolescent brain needs to be protected. It is very vulnerable. It is growing. It is developing. And it's very important that parents do everything they can to protect that child's developing brain, because substances can interfere with that development and growth. Um, when I was working with the kids that were smoking marijuana, and these were very bright kids, their IQs were above average to superior in some cases. But when the testing came back, it showed that these young men and women who were smoking marijuana, that the processing speed of their brain was below average. It just wasn't clicking along the way it should be. And their short-term memory was impaired. So they might not be catching everything that's going on in school, and their motivation was low. So that's an example of how a drug like marijuana, for example, can make changes in the brain that translate many times into things that we don't readily see, but there are changes going on in the brain. So substances involved in an adolescent developing brain has the potential of curtailing some growth that's very important within the adolescent brain itself.
Yeah, and I know you mentioned too in your book, I thought it was interesting if, let's say, an adolescent is, prone from they're genetically prone to getting some sort of mental illness, it can actually exacerbate that or bring it to the forefront and kind of trigger it.
Yes, yes. If a person has a genetic predisposition to a condition, whether it's a medical condition or a psychological condition, then that person is at much higher risk of developing that disorder. And it's the same for kids.
Now, is the damage caused by drugs and alcohol in adolescence, is it permanent, or once the child is off the drug, can the damage be reversed or healed at
Yeah,
that point?
that's a great question, because our brains have a remarkable capacity to heal themselves. So once we stop assaulting the brain with the chemical or the drug, then the brain begins the process of healing and repairing itself. And that's a process that really is quite remarkable. And we can actually see improvements in the brain over time. Now, how much time that will take, that depends on a number of factors. How young was the person when they started? How long did they use a substance? And what particular substances were they using? But regardless of all of that, once the person stops using the substance, the brain has a remarkable capacity to heal itself.
Yeah, it's an amazing, bodies are amazing things.
Yeah, and
Now you,
especially the brain.
yes, especially the brain. Now you really stress in your book that a lot of substance abuse problems, like we talked about earlier, stem from underlying issues, which is why it's important to do the comprehensive psychological medical assessment before
Yeah.
starting treatment. Can you just kind of go in a little more detail about that and what type of underlying issues, if maybe give some examples, have you seen or experienced when treating adolescents?
Yeah, I've seen a whole range of psychological issues. Like I was saying earlier, most of the children that I worked with, the teenagers that I worked with, who were using marijuana, were suffering from an intense anxiety disorder. Some of them were suffering from depression. Some of them had a history of post-traumatic stress disorder, or maybe being bullied in school. Others had an emerging personality disorder that was just starting to break through, like schizophrenia. So not in all cases, but in a lot of cases, there are these underlying issues. I think the one that I see the most in children is anxiety, some depression, but there is an awful lot of anxiety within the adolescent population. And for one reason or another, a child learns that using using a substance helps medicate that issue. They're no different than adults. We don't like having an intolerable thought or an intolerable feeling or an intolerable memory. We don't like sitting with those intolerable emotions, and we're going to do something to resolve it. And that something, in many cases, involves using a substance.
Right. So it's the holistic approach.
Yes.
Can you talk a bit about, you have a chapter about compulsive disorders. What are they? What are the most prevalent ones today in teens, and how they're detrimental in adolescents' health and well-being?
Yeah, we refer to those as process disorders. We have chemical disorders, which is the alcohol and the drugs, and then we have process disorders, which are more behavioral in nature. Examples would be self-injury, would be a behavioral disorder. Gambling would be one, and those disorders, those process disorders. Others would include gaming, video gaming, excessive cell phone use. Um, all of these activities have the same effect on our brain, the chemistry in our brain, that the chemical addictions have. What they all have in common is they increase dopamine within the brain. Dopamine is a neurotransmitter. It's a chemical in our brain that causes us to feel pleasure. So that when we go out on a date, or we go to a movie, or we have a meal, we feel pleasure. Well, it's because dopamine rises in our brain. Well, what drugs have in common, and these process disorders have in common, is that they cause huge surges of dopamine in the brain, which results in the intense feeling of pleasure that people get from taking a drug, or from, playing a video game, or being addicted to the cell phone. You can actually see sometimes when a teenager's cell phone lights up, or they get a text message, there's a rise of dopamine. They actually get a pleasurable feeling on that. So these process disorders can become compulsive, and they can become destructive, and they often can accompany a child with a chemical disorder like alcohol or marijuana. A child can have both.
Interesting. Now, the pandemic has been really difficult for all of us, especially children and our teens. The pandemic impacted these teen compulsive process disorders, their mental health, drug abuse? Are we seeing any upticks in those areas?
Yeah, that's a great question, because the pandemic has had a tremendous effect on adults, on children, on families. It's disrupted life across the board. And I think we're just now beginning to understand some of the effects of the pandemic on mental health for both adults and for adolescents. The Centers for Disease Control not too long ago indicated that since the pandemic began, there has been a significant increase in the number of adolescents showing up in emergency rooms in need of mental health care. It's been a dramatic increase. And I think we're just scratching the surface on learning some of the effects of the pandemic on people's mental health. And now that we're moving back into the traditional classroom setting, I think for some kids, that may be a tough adjustment as well. It was a tough adjustment being pulled away from it and being isolated at home. And now getting back into the traditional classroom setting might be a struggle for some kids. And as parents, we just need to be sensitive and aware of that, and pay attention to how our children are behaving and reacting, and have some discussions about it.
Yeah, and that kind of is one thing I really love about in your book, is your approach, and you recommend, that parents really keep an open and honest dialogue with their teens about drugs and alcohol. For example, you talk about if a child has a relapse while they're in therapy, instead of making it negative, you state if your child can turn a relapse into a learning experience rather than a failure, you lessen the chance it will actually happen again. And you have quite a few really great strategies for helping shift a child out of substance abuse and into what you call the action stage. Can you share a few more of these strategies that have been successful with your work?
I think when you discover your child is using a substance, many parents' first reaction is either anger or panic and questioning what kind of a parent they've been. And I'm often asked, well, what's the first thing I should do if I think my child's using a substance? And my answer is the first thing you should do is have a discussion with your child. Not to accuse them of anything, not to threaten them, not to punish them, but to take an inquiring point of view, a curiosity point of view. I'm seeing these behaviors. Can you help me understand why I'm seeing them? Have that kind of a discussion. I'm concerned about this. Can you help me understand it? And see what kind of a discussion you can get with your child. Now, that's a discussion that's likely to go one of two ways. It's either going to blow up and the child's going to become defensive and argumentative and angry, or it might go the other way and you learn some things. But regardless of how that discussion goes, if you're still concerned, you need to move to the next step and get the assessments done that I recommend in my book. And the other thing I would say is in communicating with your child and communicating with each other as adults, we're really good at listening to each other's words. We can do a good job of hearing words. We don't do such a good job of hearing the feelings behind those words. So that when we're talking to each other or we're talking to a children, we hear not just their words, we hear and reflect back the feelings behind those words. And that's a skill that every parent can learn and they can practice so that over time they get better, that when they're talking to their child, they're really tuning in on the feelings that they're hearing from that child and reflecting those back to the child to get some feedback. That can be a powerful communication tool for parents.
Absolutely. Really actually connecting on an emotional level, not just
Yes,
questioning and kind of giving them the third degree about it.
absolutely.
Yes, very important. Can you give us a rundown of what drugs today's teens are using? Just so we all have an idea, because I know that changes and evolves.
It does. Kids today are still gravitating towards alcohol and marijuana, and that's been true for a long, long period of time. There still is some exposure to some of the other drugs like LSD, cocaine, some of the opiates, some of the prescription drugs. But those tend to be very small percentages in the adolescent population. Kids still are gravitating towards alcohol and marijuana as their two primary substances. But what we've noticed in the last 3 years is an alarming increase in what is known as vaping, where an individual will take a substance like marijuana or nicotine. They'll put it into a vaping instrument, looks like a pin or a USB drive. There's an atomizer in that instrument that turns the material into a vapor, and then it's inhaled, and that's what's called vaping. Well, in the last 3 years, the percentage of adolescents who are vaping nicotine and marijuana has risen dramatically. An example would be 3 years ago, the percentage of high school seniors that were vaping nicotine was 18%. Today, it's 34%.
Wow.
The percentage of high school seniors 3 years ago that were vaping marijuana was 9%. Today, it's 22%. So there has been a dramatic increase in kids turning to vaping. And some of the research that's coming out from the University of Rochester Medical Center is showing that for both adults and kids who vape, they're starting to show difficulty in concentrating and remembering. So this in the or in the adolescent population is really something that I think we need to be concerned about and pay attention to because it is increasing.
Interesting. And yeah, I guess vaping, let's say marijuana is a lot easier to hide and cover up than if you were just having to smoke a joint.
Yeah,
perspective.
it is because a lot of parents don't recognize the instruments. Some of them look like pins, like a jewel. Some of them look like USB drives, and they can be used very rapidly and quickly. You know, you can just inhale a couple of puffs and put it away. Whereas if you're smoking a joint, you can't do that. So they become much easier for kids to use and to conceal.
Yes. Well, thank you so much for joining me today and all your really amazing work you've done over the years to help save our children's lives, and also for your book that gives parents a really great roadmap and resource to help them navigate this. I learned so much today from you and from reading your book, and I'm going to post a link below to your website and to your book for those who would like to connect and take a look at it. Do you have any final words for all the parents out there working through substance abuse with their child?
Yeah, I guess my message would be one of hope. You know, this can be a very frightening topic for parents. Parents want to stay away from it, but that can be a very dangerous approach. I think knowledge is power. So if you have an opportunity to read this book, and it only runs about 100 pages, because I know parents don't have time to read volumes of information, hopefully you will feel more empowered. You'll feel more knowledgeable. You'll feel more secure and more prepared to deal with this issue. Or if you know somebody who's dealing with this issue, it might be a great resource for them. But my message is one of hope. You and your family can get through this. You and your family can come out at the other end. There is treatment that is effective. Treatment does work, and you and your family can recover from this if you're going through it.
Beautiful. And yes, your book is, it's definitely an easy read, and there's so many resources in it as well. So it just kind of makes it all more seamless process to
Great.
face. Well, thank you again. And like he said, knowledge is power. The more you understand about your body and these types of health issues, the better you're able to stay healthy, prevent disease, and keep your loved ones safe and healthy. And just a reminder, I'm not your doctor, so please don't take this as medical advice. If you have specific questions about your specific case, your healthcare, feel free to reach out to your practitioner. If you like this video, please like it and share it with others. This information could really help someone you may know and save a child's life. And also hit the subscribe button to be sure you don't miss out on our future shows. And stay tuned for the next episode of Discovering True Health.